Hi, this is Neil Hansen, and I'm taking you through a kidney donor CT scan. Kidney donor CT scans are done for patients that are considering donating a kidney to a loved one, and as such you have to rule out certain anatomic variants to make sure that they're not going to be at risk if donating their kidney, as well as to help the surgeons decide which kidney to harvest for donating. We do a multiphasic study here consisting of arterial, venous, and delayed phase scanning. Some places will add in a non-contrast scan to look at stones, because if you have a heavy stone burden, that's a relative contraindication for donating your kidney. Here we found that on the arterial phase, you can usually make out kidney stones if they're of significant size and number, so we elect to spare the patient radiation and actually do not do a non-contrast scan. The first phase that we get is the arterial phase, or some people call it the corticomedullary phase, because when you look at the kidneys, you can make out differentiation between the renal cortex here and the medullary pyramids. This phase is done with the main purpose of evaluating the renal arteries. So it's important to comment on the renal arteries, how many there are, and if there's any early branching. People have a lot of anatomic variance. For example, I've seen cases where there were 3, 4, or 5 arteries supplying an individual kidney, and that makes them basically unable to be donated for transplantation. If you have 2 renal arteries, sometimes the surgeons will do it and just do multiple anastomoses, but once you start to get to 3 or above, it usually makes that not donation possible. Additionally, you can see here on this coronal image, the left renal artery has an early bifurcation. So if there's an early bifurcation of the left renal artery, you want to comment on that, because it could make it difficult for the surgeon to anastomose this little nubbin of renal artery to the recipient vasculature, and they may elect to pick the contralateral side for harvesting. So the first phase is arterial phase. Comment on the location of renal arteries, as well as how many of them there are and whether there's early branching or not. The next phase here I bring up is the portovenous phase. This is useful for looking at renal veins. So here's the left renal vein. In this case it's pre-aortic, but that's not always the case. Sometimes the left renal vein is circumaortic, i.e. it wraps around the aorta, or retroaortic, which makes it technically more difficult for the surgeon to harvest that kidney. So always look at the venous phase and describe especially the left renal vein, whether it's circumaortic, pre-aortic, or retroaortic. The delayed phase that's obtained is called the nephrographic phase. We wait a couple minutes, and as you can see, all the contrast is now in the collecting systems. We want to evaluate the collecting systems because, again, the surgeon is going to have to anastomose the ureter to the recipient's bladder, and they need to know if there's any congenital anomalies. You're looking specifically for duplicated or partially duplicated collecting systems, or other anomalies such as ureteroceles or things like that, which could potentially alter surgical approach. I find that collecting systems oftentimes are best seen on a coronal reconstructed image. Here they didn't provide one, so we can always make one. So if you bring up the axial image and you want to make a coronal image, you just simply click the multiplanar reformat button and click coronal, and you can get an image of one. So if you were thinking there was a duplicated collecting system, you can come here and look and see that there is in fact only one, and you can follow the ureter going down. Frequently our techs will make 3D reconstructions also, which can be quite useful. We have a template for reporting these studies because they are asking for very specific information, and I'll tell you that the first thing you should do for a kidney donor is look at the renal parenchyma, comment on the presence of cysts or masses, look at the collecting systems in ureters, make sure they aren't duplicated, count the number of renal arteries on each side and look for early branching, and look at the renal veins and describe especially the left renal vein and its anatomy related to the aorta. Always look at the bladder also, just to make sure there's not a cystocele or a ureterocele.